I'm Michael O'Rourke, CEO of Ravana Therapeutics. Every 5 seconds, someone in the world goes blind. In the UK, 100 people a day start to lose their eyesight because of serious deterioration of a conditions, many known as different macular degeneration conditions or glaucoma. Unfortunately, most of these conditions are treated with frequent injections into the eye, which can often be uncomfortable, or with daily eye drops, but most people do not know how to use eye drops successfully. About 90% of patients cannot use eye drops. Ravana Therapeutics are developing biodegradable implants into the eye that can sustain the release of a drug for 4, 5, 6 months or even longer. And it's a £25 billion market that we're currently going to be able to compete in. So who are Ravana? Ravana is a startup out of Queen's University in Belfast. But we also have an international presence. I'm actually based in Tampa, Florida, so we do have access both to the US market and to the European markets. What makes it special? We have great technology that we believe has several competitive advantages over anyone else in the market. But we also have a great team, a strong board, passionate team, and a scientific advisory board that also includes the ex-CMO, Chief Medical Officer of Bausch & Lomb worldwide. Last year we raised £1.2 million. Since then, we've achieved a strategic collaboration with a major pharmaceutical company. We've already achieved milestone 1 with them by taking their drug into our technology. We've progressed the team, we've strengthened their operations, and we've enhanced their IP. So with that, I'd like to thank you very much.
Hello everyone, my name is Yusuf. I'm a medical doctor and the co-founder at Quit Genius, a mobile app that delivers personalized therapy to help people quit smoking. So why smoking? Well, it's still the single biggest cause of preventable deaths around the world, with a market worth over $10 billion per year. But the really crazy part is that over 70% of smokers actively want to quit, yet only 3% are actually successful. Quit Genius works by delivering a personalized journey of animated videos, interactive exercises, and audio sessions, which all come together to change the way a user thinks about smoking. What's more, every smoker is different, and so with each interaction, Quit Genius learns more about the user and intelligently adapts the program to better suit them. My co-founders and I hold both medical and business degrees from Imperial College, and I have experience successfully founding and selling my first tech business at the age of 14. We've raised over $2 million from Merck, Y Combinator, and other Silicon Valley heavyweights. And last year, we won the National Pitch at Palace Awards. Our technology has been peer-reviewed in 3 research papers. But the real number I'd like to share is that in the past year, we've already helped tens of thousands of people quit smoking. We've done it for smoking, which means we can do it for other mental health conditions and addictions. I joined medical school to make an impact on the lives of thousands, and I left to make an impact on the lives of millions. Thank you.
Hi, I'm Sheridan from Camalogy. So 11 years ago, a pair of Cambridge researchers started developing a treatment for peanut allergy. And a few years ago, they met a management consultant looking for a way out, with zero pharma experience, which they saw as a good thing. But I did make up for my experience with hunger, and I saw the size of this opportunity. Peanut allergy is a very severe disease, and although we never really heard of it at school, it now affects around 2% of children in Europe and the US. And it's a very severe problem. If anybody in this room has a child with peanut allergy, or as I've heard earlier, a wife and possibly 2 children with peanut allergy, you'll empathize with the anxiety that this causes. You'll be carrying EpiPens, you'll be constantly reading labels and asking and double checking what's in this food. Are you really sure? And when your child starts to go away, who's looking after them? Are they going to be as diligent as you? Will they know what to do when they suffer a reaction? And it gets even worse when they start to go away, go to school or go to university. These times cause great anxiety. So over the past few years, we've turned this from an academic project into a spin-out company. We raised funding, built a team, and developed a drug. And I'm proud to say that we've now treated our 160th patient at the clinic in Cambridge, and we're achieving an unbelievable 97% success rate. So building on the success, what we need to do now is set up our manufacturing. We've hired a US-based CEO to help us raise the funding that we need to get through the clinical trial and eventual IPO in order to make this treatment available worldwide. 11 years in the making, we've got a few years still to go, and hopefully peanut allergy will be a problem solved. Thank you.
Okay, good evening, ladies and gentlemen. My name is Ian Johnson. I became the CEO of Ingenie in June of this year. Ingenie was founded in 2013 and last year enjoyed a successful fundraising event with the SyndicateRoom. So what does Ingenie do? Well, Ingenie are deploying a public network of electric vehicle rapid charging points. So you may have read recently that the government has announced a target to that by 2030, 50% of all new vehicle sales will be either electric or hybrid. But the revolution is already happening today. And in fact, last month, 1 in every 12 vehicles that were purchased in the UK were electric or hybrid. At the same time, the biggest reason given by drivers of vehicles in the UK as to why they haven't yet made the change to electric is because of the lack of a public charging network. So Ingenie are setting out to change this, and our ambition is to install over 1,500 rapid charge points over the next 3 and 4 years. To do this, and thanks to the fundraising, we have built an excellent delivery team where we've recruited some of the best business development managers and project delivery managers, both from inside the industry and from outside the industry. That team has helped us to land our first national deal, which will see us deliver over 400 rapid charge points across the UK starting in October. Ingenie's business model is very simple. We fund 100% of the upfront cost of installing the charging infrastructure. We fund 100% of the ongoing operational costs of running the system and serving the customer, which means that our commercial landlord partners can offer a charging solution for their customers, which drives footfall, at no cost to their business. Plus, we also pass on a share of the profitability from the site. So where will you see an Ingenie rapid charger? Well, Ingenie targets sites where there's high vehicle driving footfall and where the customer behaviour sees them spend between 20 and 60 minutes on the site. So you can all expect to see Ingenie deploying a rapid charger at supermarkets, restaurants, drive-through coffee shops and retail parks near you in the coming months. I'd like to finish on why are we doing this? Because beyond working in an exciting marketplace, very fast-moving marketplace, there's one common thread which runs through every member of the team and every member who joins our team over the last few months. And that is that we all want to give something back. I myself have two young daughters. Both of the girls will die 2 years earlier than they should do because of the air pollution that I expose them to by bringing them up in London. So this is how we give something back, and it's how we make a difference by accelerating our country's transition to a zero carbon future. Thank you.
Hi, I'm Adam, Chief Executive of Cambridge Nutraceuticals. I'm going to talk about Glynis. Glynis suffers from joint pain. She has fibromyalgia and MS. She says, I was like a crippled old lady. Some days, I could only get round the house on all fours. I was in so much pain, I was prescribed 6 bottles of morphine a week. Medicines didn't work. Inflammation took over her body. Glynis read about one of our products, Turmeric Plus, a powerful, natural, absorbable anti-inflammatory. She tried it. It did work. Searing and excruciating pain was replaced by a dull ache. She can use her hands again, to grip, to put her socks on, to tie her laces. She walks again, unaided. Her doctor, so impressed with the results, asked her for details for his wife's arthritis. She's a customer too. We're Cambridge Nutraceuticals. We sell clinically proven health supplements that improve lives. The $100 billion global market for health supplements needs fixing. Murky and often misleading marketing messages, myriad brands confuse and confound customers. We are different. We sell supplements as they should be sold, supplements that work. Supplements supported by research and results, supplements supported by science. We built ourselves for scale. We recruited a management team that combined has over 100 years of relevant experience, managed over 1,000 people and worked at the top of billion-pound companies. We're configured to be big. And to get big, we'll repeat what's already worked on a small range of products, on a larger range of IP-rich products, to turn our tens of thousands of customers into hundreds of thousands, and then millions. Thank you.